National Seniors is the independent voice for older Australians, our nation's fastest growing demographic. We want to make sure Australia is a great place to grow older for everyone, and that means advocating on the issues that matter to older Australians. Hello, I'm Ian Henschke, your Chief Advocate at National Seniors.
And we're having an extra busy time at the moment in the run-up to both the budget, which is due on April the 2nd, and the federal election, which is due on May the 11th or the 18th.
The federal election is an important opportunity for National Seniors to put forward a number of recommendations for change to improve the lives of older Australians. Our recommendations are set out in our Federal Election Priorities document, which is available to download from our website. There are a range of things we're fighting for on your behalf in the upcoming election, and I want to take some time to run through these with you. The first are reforms to the age pension and other related payments, which we're pursuing as part of the Fix Pension Poverty campaign with the Benevolent Society.
Now, essentially what we're fighting for is the establishment of an independent pension tribunal. Now, the aim of that is to have a tribunal take the politics out of the age pension. It seems that every time there's an election, there'll be a new policy around the pension. And sometimes, once a government gets in, they fiddle with it again. We want an increase in the maximum rate of Commonwealth rent assistance as well, because older Australians, the ones who are worst off, are the ones who don't own their own home, and they have to rent. We're also asking for a subsidy for pensioners to connect to the NBN or another appropriate internet service. And this is also because governments and business are increasingly only offering essential services and information online. Also, we'd like to see the expansion of basic dental care for pensioners. Given the high rates of poor dental health amongst older people, we believe this is essential. We also know that dental health, poor dental health, is linked to other health issues. We're also tackling the cost of electricity with the need for the energy supplement, which is provided to seniors, to be indexed to the CPI.
As part of our election campaign, we're calling on all parties to maintain a fair and simple retirement income system. You may remember that as many as 90,000 retirees lost their pension in 2017. This was due to changes to the asset test taper rate. We're continuing to call for a reduction in the taper rate from $3 to $2 so retirees are not penalised for saving for their retirement. We also want to support older Australians to downsize for a better and safer life in retirement. We're calling on the government to allow retirees with limited superannuation or assets to unlock the wealth in their family home by exempting up to $250,000 of home sale proceeds from the age pension means test.
The big issue for hundreds of thousands of self-funded retirees is the ALP's policy, which it says, if they get into government, will be to cut franking credit refunds, which will have a massive impact on the incomes of self-funded retirees. And it will mean many of them will have less than the age pension to live on. In fact, there will be situations where people will be better off being on the pension with their credits, which we fought for and won last year, than those will be who are self-funded and they don't get their franking credits.
We know out-of-pocket healthcare costs are the biggest concern of older Australians. We recommend all specialists publish their fees on a public register, and all GPs make patients aware of choice when referring to a specialist. We also call on the Australian Government to ensure older Australians can continue to retain private health coverage by restricting premium increases to no more than CPI. Excessive wait times for all essential services such as Centrelink are unacceptable, and National Seniors is calling on the Australian Government to ensure that call waiting and processing times at Centrelink meet community expectations, so older Australians can access services and assistance in a timely manner. No older person should suffer from abuse, and National Seniors is calling on the Australian Government to expedite efforts to create a nationally consistent power of attorney legislation and a single national register for these documents. The other thing we're fighting for in the election is urgent reform to aged care. we're seeking, first of all, a commitment to triple the number of home care places available. That will eliminate the waiting list for home care services. We also want all residential care providers to be required to report staffing ratios, and for all staff providing direct care to have basic training in dementia. Aside from the election, our aged care work is one of our key advocacy areas for National Seniors.
On top of that, we're actively involved in the Royal Commission into Aged Care Quality and Safety. Now, that was announced late last year, and I appeared at the first round table just before Christmas, and I voiced your concerns about the lack of home care packages. There are more than 100,000 Australians waiting for a package that meets their needs. I also spoke about your general feedback on the difficulties in negotiating the complex aged care system. Now, Professor John McCallum is our CEO, and he's also the head of our research department, and he's just put in a witness statement formally setting out our views on quality and safety.
What I'd like to, to focus on is what we're left with after all that work, which is, I suppose, significant shortfalls in home care which are not being redressed, consumer-directed care which has been in the pipeline for a long time, which is struggling but getting there, regional provider issues which are perennial and probably difficult to struggle. We certainly have we've dealt with the regulators, but we're in a very new phase of that. We had 2 regulators, now we're moving to 1. And issues of dignity and respect, I think, are on the table more than they ever have been. The running sore really is the waiting list for home care, and that's really profoundly a critical failure. We know that home care on level 1 evidence is preventative for death and preventative for hospital admission. And we have a study here from SAHMRI showing that if you spend 6 months longer waiting for home care, when you first then get into home care, you're 10 times more likely to go into residential care. So that's very fresh local evidence. So we know that that's the case. We haven't really dealt with that and really dealt with the fact that people then have to go into residential care, into hospitals, which are much more expensive, and it's economically irrational, but we haven't dealt with it. We haven't dealt with it because it is hard, and so I think that's what I mean by dodging. This is hard, and we'll leave that for next time. But it's something we really have to deal with because it's, as I said, it's the most difficult, immediate issue we have to confront.
National Seniors at every level is working tirelessly to make sure Australia is a better place for all older Australians. As we often like to remind those in power, every second voter is now over 50. We simply ask that they be given a fair go. Whatever party is in power, we're going to continue to be your independent voice.